Hi friends, welcome to yet another episode of Future Midwife. In the last video, I promised you this class will be the continuation of puerperium. So in the last class, I just started with the minor ailments of puerperium. So this class, we will continue with the minor ailments of puerperium. So what is the importance of minor ailments in midwifery topic? This minor ailments of pregnancy will be a 100% sure question for both BSc nursing and GNM students when we consider the examination. So because of that, I told you I will take next class little bit elaborate about this topic. So this video we will continue with the minor ailments of puerperium. Moreover that I have a request to my viewers. Most of my videos contain more than 300 viewers. I have only 165 subscribers. One of my videos called abortion, which has been seen by more than 2.5k viewers. So which indicate apart from the subscribers, most of them are watching my videos. So while watching, if you are subscribing, it will be a great support for me. So I expect this support in the future also. So without wasting time, we can move on to our today's topic, minor ailments of puerperium. Following the childbirth of the baby and the expulsion of the placenta, the mother enters to a period of physiological and psychological recuperation. This period is called puerperium, so which will be start immediately after the delivery of the placenta and membrane, which extend till 6 weeks. There are few minor ailments of puerperium I just want to discuss in this video. These are afterpain, pain on the perineum, breast engorgement, postnatal diuresis, lactation suppression and constipation. So we will see each one of that. First we'll see about afterpain. It is a spasmodic intermittent pain felt in the back and the lower abdomen after the delivery of the postnatal mother. So which can be seen 2 to 4 days following the delivery. That means the mother will experience such kind of spasmodic intermittent pain following the delivery that will be up to 2 to 4 days. So actually why there is a after pain? So after the birth of the baby, some placental bits or blood cords will be remain in the uterus without expel it. So once there is any placental bits or membrane retained in the uterus will automatically try to expel it out. So the uterus will try to expel it by means of a spasmodic hypertonic uterine contraction. This uterine contraction we called it as after pain. How we can manage this after pain? If mother experience such kind of after pain, we can massage the uterus. So while doing massage, the uterus will contract and uterus will try to expel the retained clots or placental bits. Apart from that, we can manage it by analgesics and antispasmodic medication. Next will be the pain on the perineum. So usually the pain on the perineum can be felt by the postnatal mother due to the overextension of the perineal muscles and skin during the labor process. Some of the preemie mothers experience pain due to episiotomy. So usually there will be a mild pain will be present on the episiotomy sutured area. Then if the pain is persist for a long time and the pain is increased day by day, which has to be examined properly. Sometimes the vulvogenital hematoma formation can be occurs. So if there is any hematoma formation, which has to be surgically explored and treated properly. If there is no hematoma formation and the pain is mild, which we can manage by some of the measures. Every postnatal woman should wash their perineal area with a warm water after each toilet use. After that, she has to wipe it with a sterile tissue. It is very important while wiping, keep in mind that she should wipe from the front to the back. Why means while wiping from the back to front, there is a chance of spreading the microorganism from the rectal area to the vaginal area, which can contaminate the vaginal area and lead to the infections. So in order to avoid that, she should wipe their perineal area from the front to back with a sterile towel or sterile tissue. So other than that, we can give a sitz bath. So I am not going to explain much more about the sitz bath. I think all the nursing students, they know about the sitz bath. So she can perform sitz bath in a intermittent interval, and also she can apply some cold pack over the perineal area. Next will be the breast engorgement. This breast engorgement usually mother experience after the 3rd day of postnatal period. So this will be experienced once there is a excessive production of milk start. So there will be an excessive production of milk in the mammary gland, but it will not be expelled out due to the lack of baby suck. So usually the mother experience breast engorgement due to the lack of breastfeeding. So in this condition, mother experience a hard, tender, painful breast. So while palpating, we can understand there is a hard tenderness mother experience while touching the breast. So this can be managed immediately, otherwise it can lead to breast abscess. There is only one solution, that she has to try to feed the baby in a regular interval. Then she can expel the breast milk. So after each expulsion of breast milk, she has to try to put the baby into the breast and start breast feeding. So if she experiences a severe pain, we can apply some cold pack over the breast, and she has to take a more oral fluids. If there is severe pain, it can be managed with analgesics. Sometimes mother experience malaise and mild body weakness along with this breast engorgement. So breast engorgement is not a major complication until and unless it develop a breast abscess. So try to solve it during the breast engorgement stage itself. Next minor ailment is postnatal diuresis. Within 12 hours of birth, the mother begins to lose the excess tissue fluid which has been accumulated during pregnancy. So because of that, mother experience excess diaphoresis, especially during the night time. This kind of diaphoresis mother can be experienced usually 2 to 4 days following the delivery. So how we can manage with this diaphoresis? So she has to change the dress frequently. The bedsheet and pillow cover has to change regularly. She has to drink a sufficient oral fluids. With all these measurements, we can manage the postnatal diuresis. So this postnatal diuresis is not a major ailment, so that she can manage by herself. Next will be the constipation. So constipation is very rare during postnatal period. Some mothers experience this constipation due to the lack of oral fluids as well as the lack of roughage and vegetables in their diet. If the mother takes sufficient fluids and roughage containing diet in her diet, she can avoid this constipation. If the constipation is persist for a long time, she can use some kind of laxative, especially in the bedtime. Here we reach the last minor ailments of puerperium, that is lactation suppression. Lactation suppression is a very rare condition. Usually it never occurs to the postnatal mother. But in some rare condition, if there is any lack of production in the prolactin, can be lead to lactation suppression. if there is any reduction in the production of prolactin which can affect the lactation. So usually the mother can avoid this lactation suppression by her own ways. Some measures include she has to feed the baby in a regular interval, and while feeding she can feed the baby at least 15 minutes for one breast followed by another breast. That breast also she has to feed at least 15 minutes. Then before feeding and during feeding she can massage her breast. Then another one is diet. She can include a well balanced diet in her daily diet routine, especially vitamin rich and protein rich diet. She need to take a sufficient oral fluids. So these all some few measures she can do by herself in order to initiate the breast feeding. So once there is a sufficient breastfeeding, automatically the production of prolactin also occurs. I hope I have explained the sufficient content which is related to minor ailments of puerperium. So usually this minor ailment of puerperium will be asking for a 5 marks question for the nursing students. I think this content is enough to perform the examination well. There are few major complications of puerperium also that I will discuss in the following videos. So here we can wind up our today's section. So we will meet with another episode of midwifery topic. So till that, take care. Bye bye.